Okay, so we're going to start talking about just the general expectations for the class. This is the orientation to online nursing. And I did email everyone. Did everyone get the email that has the PowerPoints for this week? If not, please check your email. I tend to email them instead of posting them in the announcements because I can only post one attachment to each announcement. So look in your email. Usually on Sunday, I'll send out whatever the information is that we're going to go over for that week. So I don't think this is anyone's first online class, but this is just kind of a general overview of what online learning is and what our expectations are. Um, so I want you guys to interact with me as much as you need in order to really learn the material. So if you're struggling with anything, please contact me. I'm always available to meet with you one-on-one. And during class, if you have questions, you're free to ask. I don't want anyone to think that this is a time when I just sit here and talk. I want you guys to interact with me and talk to me and try to make this as interactive as possible, even though we're doing it all online. You guys do have weekly homework assignments, so they're always due on Sunday night of that week. So they'll be due, they weren't due yesterday. They'll be due on Sunday coming up for the discussion questions that you guys had to do for this week. And please go over your syllabus. I try to put all the dates into the Canvas shell, so everything should be up there for you to be able to follow along. But doing your homework is really important, and it helps you stay, engaged with the material that we're talking about. And if you guys are staying on top with your homework assignments, you're a lot more likely to do well in class.
Oh my God, you can make my people. I promise you.
So there is, a chain of command in terms of who you should be contacting if you have any questions about anything. So I am your first contact, and I put it in the campus information about your instructor, but I'm also going to just go ahead and put in the chat here. To be honest with you, I teach part-time, so I am not always on my email. So I'm gonna put my phone number here. So you are free to send me a text message. That is by far the easiest way to get in touch with me. So you can send me a message in Canvas and I'll get back to you within 24 hours. But if you're like doing your homework and you have a question and you don't, you're not going to have time to finish your homework tomorrow, then you're welcome to send me a text message. I'm never insulted, and I'll text you back. So I'm just letting you know, because sometimes students, they don't want to bug me, so they'll send an email before they send me a text message. But I'm not online when I'm not teaching. I'm probably not checking my email unless it's just a couple of times a day. So if you're really needing in touch with me, the best way is to go ahead and just send me a text message. So if for some reason I cannot answer your question, I will find the right resource. You also, if you're very unhappy with me, I'm not providing you with the answers that you need, you have like questions that I'm not answering, whatever, you are always welcome to go to the Dean of Online Nursing. I think you guys all know who Narlene Brown is. So this is her phone number and this is her email address. So, at the beginning of every class, I always let students know, I really want you to come to me first, and I'm fine with you sending me a text message. But if for some reason I'm not able to answer your questions, you are welcome to go to the Dean of Online Nursing and contact her directly. So this is kind of reiterating that same information. I'm your first contact. I'm not angry if students go directly to Darlene Brown, but I promise you that I will try to answer whatever questions you have and help you out the best way possible. So please contact me first, and then I will, I pledge to you to be respectful and courteous, and I expect you to treat me with the same respect. So this is just going to kind of go over a little bit of like, professionalism in nursing. I promise you that I have your back. I want everyone to succeed. So if you're having a problem, if you're, you don't know where you're going to live, if you lost your job, if you're having some sort of emotional problem, or if you're sick or whatever it is, if you let me know before something's due or before you have a test or a quiz, then I will 100% work with you to try to make sure that you are able to get your homework done or take your test or whatever needs to happen. But just, to keep me involved, and don't not come to class and then tell me after class that you were sick. You really need to sort of keep me in the loop, contact me if you're having any problems, and try to, use professional language with me. And I promise to you that I will always, try to accommodate whatever's going on and help you out. So I don't know if you guys have heard through the grapevine, but we are being very strict about attendance. So even, even if you have a doctor's appointment, you're still going to get marked as not being in class. So what we do for attendance now is I print the Zoom log, and it shows you how many minutes you were logged into the Zoom. And if you're gone for 5 minutes, then you'll get docked 15 minutes. So you're docked by attendance in 15-minute increments. So, and this is not, my personal decision on how we're taking attendance. This is the school policy. So all of your online instructors should be doing the same thing. So it's always going to be based on the Zoom log. So that's why it's really important that you log in with your full name when you log into class, because I'm going to then use that information to document whether you were in class. And if you're missing for part of class, then you'll get docked the minutes that you were missing in 15-minute increments. So I just want to make sure everyone understands that. Does anyone have any questions? Because I know last term was the first term we were really strict about attendance. Does everyone understand that? Yeah, go
I
ahead.
have a question. So, not that I look forward at all to be to being in that position, but if you are in that position, how does like the makeup time go with that?
So there's no makeup time. I'll I'll post the lecture in the announcements so that you can go back and watch the announcements. But if you miss class, you miss class, and you can't make it up.
Oh, okay.
Okay. And I will say, because this is now my third time teaching this course, that, being really strict on attendance is help grades. You are going to really get the information that you need for your quizzes and exams in class. So I strongly encourage you. Extenuating circumstances, if something is going on, there are other teachers, and sometimes you can attend other people's lectures, but this is something that you need to let me know in advance so that I can arrange that for you.
Okay.
Okay. All
Thank
right.
you.
Yeah. So in terms of the homework, etc., this week there's a discussion question. So the rule for the discussion questions is that you post your initial post by Wednesday, and then you respond to your peers by Sunday. So they're I think there's 7 discussion questions throughout the term. So just always try to post your first post by Wednesday, and then to get full credit, you need to respond by 2 of your peers by Sunday. And this, the discussion questions, the first one is just, kind of basic, but it does keep you engaged with the material. So, if you're doing the discussion questions, that you're going to be reading the textbook also. And you also need to cite your sources in the discussion questions, and it can be your textbook. It's fine. You just need to tell me where you got the information. So in terms of late work, this is back to really, staying engaged with me and talking to me. You need to let me know in advance, and then you'll have a week to do it, but you get a 10% deduction. So this is going to be for like your homework, your discussion questions, etc. I'm, like I said, I want everyone to do well. I want everyone to pass. So I will, if you let me know in advance, then I'll let you get an extension on your homework, but you need to let me know in advance. So this is going back to, a little bit more reinforcing the attendance for the online classes. So make sure you're signed in, that you have your camera on, that you're not allowed to be driving, you're not allowed to be at work. You need to be someplace where you can really be engaged with class. And then if you don't come to class for 2 weeks in a row, so 14 days, then you'll be dropped. So that's something that's really important for you guys to know. So I like I said, I take the attendance from the Zoom log. So if you're not here, if you're not logged in with your name for 2 consecutive weeks, then you'll be dropped from the class. And that's even like if you're missing class at the end of the term, it's 2 consecutive weeks results in being dropped. So this slide just kind of goes over the information that we've talked about. But what's important to know is, when I go in and document how much of class you missed, it kind of calculates a percentage. So once you miss 20% of class, then you get docked a letter grade. So if you have a 98% in class and you miss 20% of class, then you're down to an 88. So they're very, very strict with the attendance, and you need to make sure that, I certainly hope no one hits this 20%. I would hate for you to have like an 82 and then you get docked 20% and then you failed the class. So you need to make sure that you're coming, that you're logged in, and that you have your camera on. So this is kind of reiterating that 20%. Once you hit that 20% absentee time, you get the full letter grade deduction. And you should kind of get prompts, once you hit 5%, you should get an email. 10%, then you have to meet with me. And then 15%, you're going to meet with campus administration. And then once you get to that 20%, that's when you get docked your letter grade. So we'll be, following up with you throughout the term if you're not coming to class. And this is just kind of going over, I think you guys probably know this, making sure that you're doing all the assignments, coming to lecture, reading the instructions for the assignments, and then making sure you study for the quizzes and exams. So, I've said a couple times throughout this orientation, keep me in the loop, contact me if you have any questions, make sure that you have good internet, make sure that you're, balancing your work life school schedule, try to have a quiet place. And, it's always good to read the instructions, but if you have any questions about the homework assignments or anything like that, just let me know and I'll make sure that you know what you need to do. You should really be logging in throughout the week. I will post an announcement every Sunday that gives you, what's happening that week, what's due, and really try not to procrastinate. Try to stay up on top of everything and follow along with the syllabus and do your work the week that it's due. I think everyone probably knows how to get to the syllabus, but I would keep a copy of it. Generally speaking, if you could read the material before class, it'll be more meaningful for you. Then it'll be more of a review opportunity for me to point out the important information. And then I'm always available to do tutoring sessions. So you just need to send me a message and I'll set up a tutoring time with you. If you're having technical difficulties, it's best to contact IT. So we do an exam review before every exam. You guys have 3 exams plus your HESI. So they'll be held outside of class. It'll be me and the other 2 instructors. There's 3 instructors this term, and you can go to mine, you can go to somebody else's. We post the videos of the different reviews in our announcement section. We'll give you a PowerPoint handout to go over the review. Students generally say that the reviews really help them prepare for the exam. So I highly, highly encourage you to go to the exam reviews. And then in addition to that, I'm available for one-to-one tutoring. So I think you all know this, but they have what they call the KGA, which is your key graded assignments. So it's your unit exams, etc. And then so 80% of your grade is your KGA, and then 20% is your homework. Does anyone know what your KGA has to be for you to pass?
78.
78.
78. So your KGA is going to be your unit exams, your quizzes, and your HESI. So these 3 things together have to be a 78 for you to pass. And then the homework, it's 20%, and doing the homework really helps you stay focused and will help you have a higher KGA. So right now the homework scores are turned off, and they'll be turned off week 1 to 5. On week 6, I'll turn them on so you can see how it's influencing your grade. And then I'll turn them back off on week 8 so that you see what you're going to need for your HESI. And then after your HESI, I'll turn them back on. If you ever have any questions, you can let me know. I can it's a setting that I can manipulate in Canvas. But, certainly just kind of by all means, I encourage everyone to stay on top of their homework. And then I would, the most important thing that's going to really determine your grade is going to be your KGA. So this is what we just talked about. You need that 78% on your KGA before your homework gets added in. So something that we started last term is that quizzes, quizzes are taken during class time. So if you miss class on a week that we have a quiz, you get a 0 on the quiz. So I just want to make sure everyone understands that it's always during class time. When you log into Canvas, you won't even see your quizzes because they're turned off. I'll turn them on during class time. You have your quiz number 1 next week. So absolutely 100% come to class next week. You have your quiz number 1. I'll try to remind you, since the dates are not in the Canvas shell, when we're going to have a quiz. I'll put it in the announcements and I'll say the week before. But I just want to make sure everyone, I had a couple of students that kind of, they didn't always come to class and they missed a couple quizzes, and it will affect your grade. So just remember that quizzes are on in class time. We'll have class, I'll turn the quiz on, you'll take your quiz, and then when you're done with the quiz, you can log off of Zoom. So you only have 15 minutes and you get one attempt at each quiz. So does anyone have any questions about that? So in addition to your quizzes, there's obviously your exams. You guys are going to be using ExamSoft, and it's best if you download the exam before you come to class. And it'll be taken on Zoom. I take a look at your ID. I make sure your ID matches your name on the Zoom log, and you have to be on your camera the entire time. So no one gets any reattempts at the exam. So if you're sick or something's going on, please let me know before the exam, because if you don't do well on the exam, I can't let you retake it. If you're having any technical difficulties, please stop and then notify me. And I've had students in the past that wanted to take their exams on campus, which I'm fine with that, but you need to let me know in advance so that I can get in touch with your proctor. So anyone that prefers in campus versus Zoom proctoring for their exams, you need to find your own proctor on campus. You need to let me know in advance, and then I'll send the code to your proctor. If anyone has any sort of accommodations, if you have ADHD or dyslexia, or there's some reason that you need additional time during your exams and you have a written accommodation letter, please let me know. Sometimes I don't always get those letters right at the beginning of the term. So please let me know so that I can make sure that everything is set up for you to get the allotted time that you need to take your tests. And this is getting into that proctored information, 72 hours. So if you're going to have it, it's classes on Monday. So let me know the week before if you're going to be taking the exam proctored on campus. And this is going over that. You have to be on Zoom, ID, you can't have anything covering your ears. I have to be able to see your work environment. So if for some reason you're not going to be able to take the exam, you need to let me know in advance. It'll be just like the homework. If it's an excused absence, I'll give you a full credit. If something's going on and your internet's out or whatever, you'll get a 10% deduction, and you need to let me know in advance. So always, always, always contact me before the exam. You guys have my cell phone number, so you can send me text messages. Don't text me afterwards because I can't help you out. So in terms of your homework and assignments, like we said, it's 20% of your grade. So try to plan accordingly. This is like an example of a calendar, however you want to set up your life. But it is really important that you stay up on the homework. And if you do so, you have a much better shot of doing well in class, because the homework kind of coincides whatever the lecture topics are. So staying engaged and staying up on your homework is going to help you do well. This is reiterating that same point that you need to let me know in advance, and then it's a 10% deduction, and you have 1 week. In terms of the NCLEX questions, make sure that you're following the instructions, and make sure that you upload the PDF. If you send me screenshots, I won't give you credit for the assignment. You have to upload the PDF in order to get credit for your NCLEX questions. You can do it multiple times. So if you don't like your score, you can keep doing the NCLEX questions and then just upload the PDF of the score that you want to get recorded. And this is just going over the instructions on how to save the file as a PDF. So, once you submit, which means that you upload the PDF, that's the score that you're going to receive, but you can repeat it. Like I said, you can do it as many times as you want. And then, so if it's 50 questions and you get 40 correct, you'll get 40 points, which is 80%. So whatever the number of questions is that you got right, that's the number of points that you're going to get. And in terms of the case study and the practice exam, unfortunately, it's not like the NCLEX questions. So I've had some students complain about this. Whatever your first score is on your case study, that's the score that gets recorded. It comes over automatically. I don't put your scores in. So just make sure that you don't have multiple opportunities for your case studies. So, think through them and try to do your best, because the first score that you get is going to be the score that gets entered. They come in across automatically. So make sure that you're using the link that's in Canvas to open them. If for some reason you need to open it a different way, I can't give you approval. You have to go through Darlene Brown, the Dean of Online Nursing Education. So this is just letting you know they come in automatically. Log in, use your link, take the case study. Don't send me a screenshot. It doesn't matter what screenshot you have. I'm going to get the grade directly from Evolve. And if you don't use the link in Canvas and you don't have prior authorization, then you'll get a 0. So I don't want to be a hard ass, but I have to apply the same rules to everyone. So these are sort of the rules for the case study. And so I'm letting you know in advance. Does anyone have any questions about that? So you guys do not have any papers, but you do have the discussion post. So this applies to you. Make sure that you read the instructions. There's a rubric for the this is the rubric for the paper, but there's a rubric for the discussion post also. The main thing is that you post your first post by Wednesday, respond to 2 of your peers by Sunday, and that you guys cite your source using APA. This is not necessarily that applicable to you. This is the same orientation PowerPoint for the students that also write papers. So, you do need to have a source for your information. It's fine if it's your textbook. So for your quizzes and exams, they're always timed. And like I said, the quizzes are always going to be taken during class. And we'll take them at the end of class. If you're having any technical issues, let me know immediately. I can't let anyone retake exams. Like if you get to the end and then tell me that you were sick or something like that, I'll be very sad that you're sick, but I can't let you retake it. So I hope everyone understands that, and just work with me and let me know what's going on if you're having any technical problems so I can figure out how to help you. So everyone is going to take the HESI at the end of the term. So you either take it on ProctorU or you take it on campus. You only get one attempt and it's 20% of your grade. The benchmark, so the ultimate goal is for everyone to get around to 900. Obviously, there's a range of scores. I don't want anyone to perseverate too much over what the benchmark is, but this is a pretty good approximation on how you'll do on the NCLEX. The HESI and the NCLEX are pretty similar. So having, this is your ultimate goal is a good goal. There is always a remediation for your HESI. So, if you get above a 900, you only have to do an hour of remediation. Whereas if you get, in the 6 to 650 range, then you have to do 7 hours. So in terms of the remediation, you need to make sure you do it. Even if you got an 860, if you don't do your remediation, it'll be a 0. So you have to do the remediation. It's based on the number of hours. It's not based on whether you see the green check mark. So I'll point this out again as you're getting ready to take your HESI, but 100% you have to take your HESI and do the remediation for you to get credit for taking the HESI. So when you take your HESI, you are going to show your badge. You have to be on camera the whole time. Your face has to be visible. And you'll be taking it either on campus or on ProctorU, and the people that supervise you on ProctorU will be looking at your face and making sure the environment is secure, and they will stop your exam if they have concerns that you're cheating. So that is the end of the orientation section. Does anyone have any questions about the basic expectations for being in an online class and taking the quizzes, exams, etc.? No, I see people shaking their head. No. Okay. So thank you for paying attention. Go ahead and take a 15-minute break. So come back at 10 a.m. and then we'll get over the lecture information for this week, and we'll do a Kahoot at the end of class also. So I'll see you guys in 15 minutes.
Mhm.
Microsoft does not have something
Okay, everyone, welcome back to class. I see people coming back in and flipping their cameras on. There's still a couple people that need to flip their camera back on, so I'll give you guys just a second before we get started. And I just want to point out, if I encourage participation, could you guys just make sure that when you're not trying to talk to me or talk to the rest of the class, that you make sure you're on mute so there's no feedback or any noise that disrupts the class. I appreciate everyone doing their best to make sure everyone's able to pay attention and hear what's going on. All right, I see cameras on. So we're going to go ahead and get started. So like I said, there's 3 chapters this week, so it's a lot of information. We're not going to have time to go over everything because it would be a total of 115 slides, but I am going to go over and point out some key information that I know that you need to know. We're going to do a Kahoot at the end of class that also reinforces some key information. And I never give you the answers to the quizzes, but I do make sure that I point out, general topics that are going to be on the quizzes. So we do have a quiz next week. The information that's on today's Kahoot plus information that will be on next week's Kahoot, which you'll take before the quiz, will make sure that you're prepared. So I would just say that like I said, I'm never going to give anyone the answers or the questions for the quizzes, but I'll, if you're paying attention to the Kahoots and if I point out anything in class, then you should be able to do fine on the quizzes. So we're going to start out doing just like a brief overview of growth and development. Obviously, kids are different than adults. And when you're talking about children, you always want to make sure you're thinking about what their age is, kind of what their height, weight, their head circumference is, if that's normal, if they're developing normally. And in this first section, we're going to talk about how you make those decisions about what's normal and what's not normal. Something that's really important is that children tend to go through growth spurts. So they'll kind of get chubby and then they thin out and then they kind of get chubby and then they thin out. But this is a process of going through growth spurts that's continuous, but it goes through a process of spurts followed by plateaus. So whenever we're talking about growth in children, who knows, is it most important what their weight is, or is it more important that they're following their growth curve? What do you think? Or do you know what the growth curve is? Yeah, right. So we'll get to the growth charts in a second, but like if you have a kid that's the 20th percentile for height and weight, and that's kind of small, that's not a very big kid, but if they're always at the 20th percentile for height and weight, that's okay. They're following their growth curve. You would worry if they were like at the 50th and they fell to the 20th, because that would be an indication that something had changed. But so generally speaking, you always want, the 2 extremes are bad. Like you don't want somebody above the 80th percentile for weight or kind of below the 20th percentile for weight. And then you'll have a big range in between there. And then you really want them kind of following along their curve. And we'll look at the growth charts in a little bit. So it's really important as a nurse when you're working pediatrics to kind of know what normal is in specific age groups so that you can see if your patient is not, where his peers are. So whenever they come in, in their first year of life, they come in frequently for height, weight checks, and you also do their head circumference up until age 2. So this next couple slides goes over the nursing process. Does anyone know what the different stages of the nursing process are? What's the first one?
Assessment.
So it is. Yes, it is. So the way that I remember it is ADPI. So assessment, data collection, and then you do your analysis, your planning, implementation, and evaluation. So you're right, it is assessment. So you're going to be looking at your kid, and then when you're looking, you're doing your data collection, and then you're going to analyze your data. And then you're going to make a plan based on your analysis. You're going to implement your plan, and then you're going to evaluate what your plan was. So these couple slides kind of go through what is in each stage. So you assess your baby, and then you do your data collection, which is going to be your height, your weight, if they're making their milestones, and then seeing how they interact with their parents. And then you're going to analyze and do your nursing diagnosis. So, if they're underweight, it might be at risk for malnutrition or, ineffective coping skills of the parent. You're going to come up with some sort of nursing diagnosis based on your analysis. Then you're going to have a plan, teaching parents, going over nutrition needs, whatever you identified as that family's problem. You're going to implement your plan. And then at the end, you're going to evaluate what your plan, if your plan worked. And then you start over at the beginning. So I would recognize the different stages of the nursing process. And whenever you're reading a test question, try to put yourself in that position. Like, what are you, the nurse, going to be doing in that stage of the nursing process? And always thinking about, you guys, we're talking about kids here. So these are two terms that I know that you need to know. They refer to patterns of growth. So this is a picture here, cephalcaudal is head towards trunk. So what this means is that like your head develops before your lower body develops. Babies are born with a really big head. They have the top of their body develops before the bottom of their body. And then proximal distal is midline to periphery. So this is going to mean like this baby is going to have trunk control before he has finger control or really the ability to do anything with his legs. So the middle of the body develops before the extremities, toes, hands, and the head develops before the trunk. So you do need to remember these two terms and be able to define them and think about them when you're assessing your baby. So what can you guys tell me? What do you think about immunity in kids? Do kids have the same immunity as adults? What ways do they develop their immunity as they grow older?
Some is acquired from the mother.
Some is acquired. How do they get some antibodies from their mother?
Through breast milk.
You can get them through breast milk. Very good. And then what's another way that babies acquire immunity if they're not sick? Like, what's something else that happens to that child that helps with their immunity?
They get vaccinations.
They get vaccinations. Very good. So if a mother doesn't breastfeed, is that okay?
Yeah.
Yeah. So, I mean, breast milk, and there's no denying it, breast milk is better for babies. But there's absolutely no reason to ever pass judgment. You don't know what's going on in someone else's life. So bottle feeding is 100% fine. They do get some immunity from their mom through breast milk. So some other things that are important about kids is their kidney function. You don't really have mature kidneys till you're around 2. So they metabolize medications differently. They're more prone to toxic effects of medications because of how their kidneys process stuff. And then their nervous system is also not fully developed when they're born. So even though they're born, they don't really have their fully developed body systems. And what can you guys tell me about respirations and heart rate in babies? Do you think a baby breathes faster or slower than like a 12 or a 13-year-old?
Faster.
They breathe faster. What would be a normal respiratory rate for a baby?
30 to 60.
30 to 60. Very, very good. And how about the cardiovascular system? What do you expect a heart rate to be for a baby?
110 to 160.
Okay, so much faster than you would. Like an adult at 100, that's tachycardia, but a baby, that's that's normal. How about blood pressure? What's the blood pressure like for a baby? So it's also lower. So like a baby might be 75/40, and that would be normal. So, I can send you guys like a handout of vital signs per age, but the main thing to really remember, okay, let me make a note. The main thing to remember, temperature is going to be, normal values are the same for every age group, but the heart rate, blood pressure, and respiration rate, they're all different for babies. So just to kind of be able to recognize what normal and not normal is. So, we do their height, weight at every, like I said, height, weight, and head circumference at every well child visit until the age of 2. And, remember that every child is unique. And so you really want to be paying attention to how that individual child is growing and then making sure that you're using your standardized growth charts. So I'm going to go ahead and put the growth charts up here. So there's one for girls and there's one for boys. And this is what I was talking about. So, if you're down here at the bottom of the curve, that's concerning, or if you're up here at the top of the curve, that's concerning. But if you're not at the very top or if you're not at the very bottom, the most important thing is you're kind of staying along your curve. And so you would worry, if a kid was here at the 25th and they were just kind of plodding along in their curve, and then all of a sudden they jumped up to the 75th, that would be a problem. And it would also be a problem if they were, kind of a big kid, they were trucking along at the 75th, and then all of a sudden they dropped. So you want, like, they go through plateaus with growth spurts, and then plateaus and growth spurts and plateaus, but generally speaking, they should be kind of staying the same on the same curve on these standardized growth charts. So there is a screening test that's commonly done in pediatrics office. It's called the Denver Developmental Screening Tool. And it looks at four areas: personal, social, fine motor, adaptive, language, and gross motor. So the main thing is for you to remember with the Denver 2 is that it's not diagnostic. So if a kid scores lower on language, that doesn't necessarily mean that they're not intelligent or they're having a hard time learning language. It's just a red flag that something else needs to be evaluated. So you want to make sure parents know that this is not an intelligence test. It's not diagnostic for anything. It's something that can be done in the pediatrician's office, frequently by a nurse, and it identifies areas where they might need follow-up. And it's not an intelligence test. So what would you think if a 3-year-old wasn't learning to speak? What sorts of problems do you think might cause that to happen?
Hearing.
Hearing, very good. Hearing could be a problem, and then they might, maybe if you got them the hearing help that they needed, they would learn to speak better. And it can also be something as simple as they're just not really being exposed to that much language at home. Maybe their parents work a lot and they have a babysitter that doesn't interact with them. So, if you notice a problem with language, then you just need to do some more investigation to figure out why, but it doesn't necessarily mean there's something wrong with the kid. So a bunch of different things influence, growth and development. Obviously people from, Korea are smaller maybe than people from Russia. So, your heredity, your nationality, and your race, all of this can influence kind of your size and where you're going to fall on that growth curve, and also your ordinal position within the family. So ordinal position within the family kind of refers to if you're the first kid, the middle kid, or the last kid. So sometimes, for example, the youngest kid in the family doesn't talk, just doesn't talk, where the other 2 kids did. And then you do some investigation and the older kids are speaking for the younger kid. So sometimes, the position the kid is in the family influences how they develop, also their gender and what their environment is. There are certain things that you need to be thinking about. Obviously, as a nurse, you're going to be paying attention to their environment that they're living in and making sure that you're giving them the resources that they need. So this is just an example of like a homeless family. As a nurse, it's not just, checking their vital signs and getting their height and weight. It's also going to be about referrals for food banks, housing, education, making any referrals to social services if you think it's warranted. So always thinking, you're not just assessing your patient, you're assessing the entire environment and the family that your patient lives in. So, we're going to talk a lot about theorists here, and we're getting close to the theorist section. So personality is, develops because of the interaction between your genome, your genetics, and your environment. So, and it's your unique organization of characteristics that determine your temperament and your pattern of behavior. So there's a lot that goes into personality development. There's 2 primary theorists that go into personality development, and they're Freud and Erickson. So we're going to watch a couple videos because I think that they do a pretty good job of talking about them. And then there's also, in the email that I sent you, there's a Word document that kind of breaks down the different theorists. So while I pull up the videos, I'm going to give you guys a second to open your email and see if you can find the Word document that has the It's like a table of the different theorists that we talk about in class. So I chose to do the Freud video first because Erikson actually built his theory based on Freud's theory. So I think they kind of build on each other. So we're going to do Freud. We'll talk about it in a minute, and then we'll do Erikson. We're only going to do 2 videos today because I want to make sure we get in the information that I think you need to know, but we'll do a little bit of Piaget and Colbert next work for a video also. Did everyone find the word handout that has the different theorists, the table? So I'm going to go ahead and hit play here. If you guys are having a hard time hearing or seeing anything, please let me know.
Of psychosexual development claims that as we grow up, we pass through 5 critical phases. Our sex drive, which Freud called the libido, focuses in a different erogenous zone at each phase. The phases are called oral, anal, phallic, latency, and genital. If our experience during any of these phases was traumatic, we might develop fixations later in life, such as neurosis, dependencies, addictions, or depression. The oral phase, age 0 to 1. In the first year of our lives, we discover the world through our oral senses. Our main pleasure comes from sucking our mother's breast or a bottle. The conflict that occurs now is the weaning from our primary caregiver. Hans is weaned off his mother's breast without trauma. Ernst's mother stops feeding him within 4 months of birth, which is too early. Ida is often left alone crying when she is hungry. Hans becomes a healthy and independent adult. Ernst suffers from trauma and develops an oral fixation. He tries to compensate for it by chewing gum all the time. Ida spends her entire life looking for the oral stimulation she was denied as an infant, and therefore develops a manipulative and addictive personality. The anal phase, age 1 to 3. The primary focus of our libido at this age is the control of the bladder and bowel movements. We have to learn how to use the potty. Hans' parents praise his attempts to use the toilet and encourage him to learn at his own pace. Ernst's parents force potty training on him too early and punish him for mistakes. Ida's parents neglect any efforts at potty training entirely. Hans develops a competent personality and a good and balanced relationship with authority. Ernst develops an anal retentive personality. He becomes an over-controlling and stingy adult with disgust for his own body and a tendency to obey authority. Ida develops an anal expulsive personality. She becomes messy, disorganized, inconsiderate of other people's feelings, and rebellious against authority. The phallic phase, aged 3 to 6. our libido now turns to the genitals as we discover the differences between the female and the male gender. The boys' conflict in this phase occurs as a rivalry with their father, also called the Oedipus complex. Ernst and Hans desire to possess their mother and fantasize about getting rid of their father, but they know that their father is stronger and fear being punished for their desire. Freud called this castration anxiety. Ida experiences penis envy. She believes that a penis is the key to power and domination and also wants one. Hans' father was very present during that phase. Later, Hans resolves this conflict by identifying strongly with him. He learns to take on a male role. As an adult, he respects both genders. Ernst, whose father was absent during that phase, fails to develop a strong sense of manhood. He has a mother fixation and is not sure about his sexuality. He also tends to be aggressive towards women and constantly needs to compete with other men. Ida, like all women, maintains her penis envy for the rest of her life, which in her case causes an inferiority complex towards men. Latent phase, age 7 to 13. In this phase, our libido is suppressed as our sexual energy is being sublimed into developing life skills. Our superego strengthens, and we strongly identify with social values, same-sex heroes, and friends. Hans follows many hobbies. Ernst loves learning at school, and Ida makes lots of new girlfriends. There is no real conflict in this phase. All three of them benefit for the rest of their lives from the skills they developed during latency. The genital phase, puberty to death. Once we reach puberty, our libido starts to become active again, and we develop an interest in sexual partners. Hans, Ida, and Ernst face the challenge of balancing the sexual desires of the id and the needs of the superego to obey social norms. The development of a strong ego helps to find a compromise between the two.
Hey guys, welcome.
Okay, so whenever we talk about Freud, I always feel like we have to be like, okay, this is just a theory, because obviously he's kind of outdated in some of the things that he says, like all women have penis envy and stuff like that. So, but it's good to kind of have a general understanding of what Freud was all about. What can you guys tell me? What's some themes that you got out of watching that video when it terms to what Freud thought about how people develop? Does Freud think it's kind of builds on each other? Like, what do you guys think about this idea that, if you are weaned too early as a baby, then you're going to have addiction problems as an adult? Do you think that's true? Do you think that, those experiences that you have young in life really have that much of an influence on your personality and how you grow up going forward? Yeah.
I
Somebody
definitely
wanna
feel like
say?
it's true. Oh, sorry.
No, yeah, no, go for it.
True.
Ollie. So go ahead and tell me what you think, Ollie.
I
The
definitely
class.
think it's true. I just don't think it's as like drastic. I don't think it's if you were weaned at 4 months that immediately you're guaranteed to be a drug addict. There's no ifs, ands, or buts. You're gonna have a nicotine addiction at 5. Like, I don't think it's that drastic. I do think though, if you are weaned too early and then you continue to get that lack of support, you continue to build on those, not really being potty trained, that neglect, then it's likely to lead to that outcome. But the rest of our life also has a big impact on that. So if when you're, if you're in the very bad situation as a child, you wean too early, you're not potty trained, neglectful parents, but you get out of that at the age of 12 and then you go into foster care with a great family, you have a really good chance of turning your life around and, becoming that super student, going to college, all those things. So I don't think it's exactly like set in stone. Well, you're weaned too early as a kid, you're guaranteed to be a failure as an adult.
Yeah, so it also has to do with your environment. Like your environment can change over time. Parenting, you could be with a parent that has a drug addiction when you're young, and then that parent could get help and become a better parent going forward. But do you generally think that your experiences young in life influence your personality and your development going forward? I'd love somebody else to speak up.
I'm sorry, what was the question?
Do you generally think that what your experiences are earlier in life, like in the first 2 years, have a big impact on the rest of your life and how you develop your personality and your skills to manage life?
I don't necessarily think that the first 2 years are detrimental, but I do feel like that as you progress, like maybe like from like 5 like on, because I feel like once you're of school age and you're a little bit your surroundings, you are more noticeable of what's going on around you.
Mhm.
And I just feel like from a personal standpoint, like I can think back and I remember things that happened to me like when I was 5, but I don't necessarily remember things prior to that time in my life. Like I guess it also depends, like if you are in a loving family and you have a loving parents and or whatever, or guardians or whatever the case may be, you probably aren't going to remember much from when you were much younger.
Yeah. Yeah, I do think it's important to remember that a lot of us don't remember really. I think my first memories were probably around the age 3 where I can really be like, yeah, I really remember that. So most of us don't remember being infants that much or really even toddlers. So I do think you're right that, it's not set in stone, but it is important to kind of think about, and we're going to do Erickson next, that like that, it kind of builds on each other. So if you develop a sense of trust when you're a baby, then you're going to be more likely to trust that the world is a good place and that you are able to do good things in the world. Whereas if you don't develop that trust as a baby, you're going to have a harder time adapting to life and you're going to view the world more negatively. So both Freud and Erikson really talk about, there's a conflict, and then how that conflict gets resolved determines a big portion of your personality. So Freud really focuses on, all of these sexual characteristics. And like I said, we can say that he's clearly kind of outdated in how he views sexual relationships and sexual development. But when we go over Erikson, then you'll see that Erikson really kind of built his theory on Freud. He kind of adds more stages to the theory, but when we watch the Erikson video, you're going to see that Erikson really kind of took Freud's sexual and kind of put it more towards a development and a psychosocial, but it has a lot of the same ideas in there. So did everyone see on your sheet, it goes through on that worksheet, it has like the name of the theorist, the age, and then the stage. So certainly when you're studying, like we're going to have these theorists, there's 4, there's Freud, Erikson, Piaget, and Kohlberg. So those 4 theorists, you're going to see them throughout the term. So I just want to make sure that, you have like a study plan in mind for these theorists, because you're going to keep seeing them over and over again. They're on all 3 tests. And then they'll also be on your HESI. And then try to think about how you might see a question on like Freud. So Freud, like a recall question would be like, what is the first stage of Freud's development? Well, you're probably not going to get very many questions like that, because the nursing questions are trying to get you to like apply information based on a theory. So, a question might be more like, what happens if in the oral stage the child's weaned too early? They're going to try to get you to apply whatever the theory says to a specific scenario. And the other thing that they might do for these theorists is they might ask you what's likely to happen if they don't have a good resolution to that stage. So, unfortunately, I feel like the theories are kind of a lot of memorization. So I would kind of start early, because especially Erikson, there's a bunch of different stages in Erikson's theory. So it's not unusual for you to have test questions where they give you an age, and then you have to be able to identify what that stage of development is, and then what should happen in that stage of development. So since it's pediatrics, we're only going to go through adolescence for Erikson because he goes all the way through adulthood. But I would just pay attention to the theorists, because like I said, you're going to see them over and over and over again. They're going to be on all 3 tests, and they're going to be on the HESI. And also, paying attention to the theories, it kind of helps you understand what we look at in pediatrics and why we pay attention to things like family environment, like why we really worry about a kid that is underweight. So, is this kid being fed at home? Is he have a good environment? Is he building a trusting relationship with his parents? All of that really influences their development and their personality and their ability to do well in school and do well in life. So we really pay attention to those first couple years in pediatrics because it is really important. So I'm going to go ahead and pull up the next video and we'll talk about it really quick.
Topic is Erik Erikson's theory of psychosocial development. Remember that the best way to study is to take practice tests. If you can't find practice tests, create your own using the Learn My Test study tool and learn while you do it. Erik Erikson adopted the belief from Sigmund Freud that development is characterized by a series of stage-related conflicts between two perspectives. He believed that you must hold both perspectives in order to achieve identity strengths, which he defined as virtues. The first stage-related conflict in Erikson's theory is trust versus mistrust, and often occurs between 0 and 18 months. During this stage, an infant must depend on their parents or primary caretakers for basic things such as food, water, shelter, and emotional needs to survive. Children who can depend on their parents for these needs can trust or count on them, while those who can't may have difficulty trusting others now and later in development. Erikson believed that children who learn to trust their caretakers develop the virtue hope, where they view the world as a good place where people can be trusted. The second stage conflict of Erikson's theory is autonomy versus shame and doubt, and occurs from ages 2 to 4. During this stage, children learn to do activities on their own without the help of their parents. For example, children learn to go to the bathroom on their own or learn to dress themselves. Parents who get upset with their children doing these activities on their own may have children who struggle to be self-sufficient later on in their development. However, parents who let their children solve problems on their own when they are ready for them will have children who have the confidence to do things on their own later in development. Erikson defined the virtue for stage 2 as will, or the child's ability to express his or herself by doing things on their own. The third stage conflict in Erikson's theory is initiative versus guilt, and tends to occur between 5 and 8 years of age. During this stage, children take a step from spontaneously doing things on their own to setting goals and working toward them. Little Johnny may want to learn how to ride a bike because he wants to be able to ride down a big hill in his neighborhood. Erikson argued that many children in early childhood, like Johnny, engage in risky behaviors when they set goals. When Johnny tries to ride down the hill, falls on his bike, and gets hurt, he feels guilty that he did not successfully make it down the big hill without falling. He may go home and act aggressively toward his parents because he was unable to achieve his goal. Erickson argued that children in early childhood can often engage in aggressive behaviors toward their parents and others because they are upset with not reaching their goals. He defined the important virtue of this stage as purpose, or having a goal or reason for performing certain behaviors. The fourth stage conflict in Erickson's theory is industry versus inferiority and occurs from ages 9 to 12. During this stage, children are more receptive to feedback from adults about their competence and begin comparing their achievement and abilities to peers. For example, children learn whether they are more attractive, a better athlete, or a more superior student than the other children in the class. They may discover things that they are good at and should pursue as a hobby. Children who receive negative feedback from adults compared to other children may view themselves as less competent, which may lead them to have a negative view about their ability and not set challenging goals that require them to perform their best. However, children who receive positive feedback from adults in comparison to peers tend to have confidence they need to pursue goals that they need to be successful later in their development. The fifth stage in Erickson's theory is identity versus role confusion. And Erickson believed that it occurs from 13 to 19 years of age. However, Erickson did state that this stage is often prolonged. During this stage, adolescents are setting boundaries with parents, such as having their own private lives with friends and romantic interests. They are also searching for a place within adult society, which can include a search for an occupation, gender, political views, and religion. During this search, children may often experiment with different identities and viewpoints in order to find their true identity. The sixth stage of Erickson's theory is intimacy versus.
Okay, so we're going to go ahead and stop there since we're just doing pediatrics. So we're not going to have to go all the way through all of Erickson's stages. But what I like about that video is kind of talks about what Erickson thinks is going to happen if there isn't that appropriate resolution, and kind of gets to this idea of like anticipatory guidance and how you're going to help parents. So if we go to that second stage, autonomy versus shame and doubt, what sorts of things should you do as a parent to help your child develop a sense of will or a sense of autonomy? So thinking back to that kid that was learning to potty train, what sorts of things do you do as a parent to help the kid, you know, feel like he is able to have control?
Like
I say
positive
keep-
reinforcement. If I'm
Yeah,
sure.
Positive
encouragement.
reinforcement. Yes. So there's two
Mhm.
things, you know, making sure they're ready to potty train, you know, so, you know, when you're too young, you don't have the muscle control to really control when you go to the bathroom. So then
Mhm.
when you try to get someone to potty train and they don't have the ability, then that can help them, you know, lead to feelings of shame that they're not good, there's something wrong with them, and it's just that they're not ready. So positive reinforcement is really good. And then also like things like dressing, like should you let a 3-year-old pick out their shoes?
Yes.
Yes, someone said yes. So why do you think you should let the 3-year-old pick out their shoes?
Because that gives them a sense of being independent.
Yeah, so that's the thing. So like they start, you know, trust versus mistrust, meeting all their needs, feeding them, changing their diaper when they're an infant. Toddler years, autonomy versus shame and doubt. You know, you want them to develop that sense of autonomy. You want them to develop a sense of independence. So you do that through positive reinforcement and then giving them, you know, choices and decisions that they can make, you know. So a lot of times if you need to get your kid out the door and you need to put shoes on and you say, put your shoes on, and they just say no. Like toddlers love to say no. So what's a different way that you can approach getting your shoes on that gives them an option? Like, do you want your tennis shoes or do you want your sandals? Something. So either way, they're going to put their shoes on, but you're giving the option of which shoes that they want. So trying to set up a situation where they're able to make a choice and they can choose something, and then doing a lot of positive reinforcement. So I'm going to say this now, and we'll also get it in when we go into the PowerPoint, but do you know in terms of timeout, like how long should a kid be in timeout? based on their age.
How long, how old they are is how long you put them in timeout for.
Right. So a 3-year-old would be in timeout for how many minutes?
3 minutes.
3 minutes. Very good. All right. So I'd love to hear you guys' theory. Did you guys see some similarities between Erikson and Freud? A little bit?
Yeah, a little bit.
What do you think of Erikson's theory? Do you think that he's on to something?
He's a lot.
Yes and no. you
Okay.
know.
Tell me why yes and no.
I feel that some like the basis of his theory is pretty concrete, but I mean, it doesn't allude to the outcome of like what's going to actually happen. So
So you're kind of like Ollie in the sense that yes, it's
yeah.
important, but your environment after those early years also really plays a role into what sorts of things happen to you. Okay,
Yeah,
I appreciate
absolutely.
that.
Mhm.
Okay. Does anyone else want to comment on the video or what your thoughts were?
I think one thing that's not taken into consideration with their theories, because it's kind of a hard thing to quantify, but you talk a lot about in growth and development that the idea of nature and nurture isn't that one does one thing, one does the other. It's very much a dance between the two of them, and you can't take into account personality. It's a little bit difficult to tell what's
It is, right. And when so in terms of like, the environment is obviously, but then also just like you're talking about like the genes that they're born with, and a lot of your personality is you're just kind of, it's innate, right? Some people are just
Right.
born stubborn.
Because you do have people who are born into horrible situations and have no reason to make it out of it, but they do. And
Right.
some people who are born in good situations and just can't seem to find their way. So
yeah, very good. So I think it's good to kind of take it with a grain of salt, right? That, there's probably, something there to like, if you develop a sense of trust, that's going to help you think the world is good. But it's, just like almost anything in this world, that's not black and white. So, there's a little bit of gray area, but in terms of, just kind of the basic understanding, we do focus on a lot on the early years when we're talking about pediatrics, and that learning that sense of trust and learning that sense of autonomy. As we focus a lot about giving parents the education and resources they need to kind of get the kids on the right start in that first couple of years, so they have the best chance going forward of kind of being successful. So I appreciate everyone for participating. And we're going to go ahead and go back to the PowerPoint. Like I said, we don't have time to do everything, so I'm going to skip around here. This slide here kind of tells you what the different theorists are, and we watched videos today on Erikson and Freud. So we'll do Piaget next week, maybe Piaget and Kohlberg. So, and Maslow, I think you've probably talked about. Maslow is that hierarchy of needs. So Maslow will also be talked about throughout the term. So I'm going to jump ahead, but you guys have this PowerPoint. I emailed it to you so you can use it as a reference. Find the right slide here. Okay, so we're going to go on to talking a little bit more specifics about infants. So we talk a lot about milestones during infancy. So these are things that, you expect infants to do at certain ages. And if they're not meeting those milestones or norms, then you worry that there's something going on. So it's good to know what the milestones are so that you can then evaluate if your patient is kind of developing the way that you expect them to. So, and this is kind of getting back to the couple of theorists that we talked about when they're infants. Freud, this is Freud's oral stage that they really like to suck, and that brings them comfort. So if you're ever having to deal with a baby that's in the hospital, even if they're not able to eat, you want to make sure that they have a pacifier, that they're able to suck on something that helps them calm them down, that helps them provide pain relief. So, just kind of recognizing that stage of infancy, and if you can, let them use their hands, because that's kind of how they explore their world. So letting infants kind of be babies is really important, and and kind of guides how you're going to make them feel comfortable if they're ever in the hospital for whatever reason. So, when we talk about milestones in infants, we're talking about, certain things that they should be doing at certain ages. So like when they're born, they have a grasp reflex. So that's going to be like you put something in their hand and they automatically wrap their fingers around that. So that starts to go away as they get older, but then they start grabbing things on their own. So, and then the parachute, this is the example of the parachute reflex. It's a reflexive thing to help protect them where they put their arms and legs out if you flip them over. And that's so they don't fall and hurt themselves. And then the pincer grasp is the ability to put things between their thumb and their forefinger to pick something up. So it's always a good idea, to have a general idea of what babies should be doing at certain ages. It's really important. So then when you're assessing them, if they're not meeting those milestones, then and you can intervene. So a lot of this here is going to get into stuff that we talked about with the theories in terms of like developing a sense of trust. You want to make sure that you're giving, the appropriate education and guidance to the parents. And then, something that's really, really stressful for parents is a crying baby and colic. So are there any parents in the group that have ever had a baby that were really, really fussy and cried all the time?
Me.
Any of you guys? Yeah. Yeah. Is that Shika?
Yeah.
Yeah. Well, Shika, tell me, what do you do as a mom if you have a super fussy baby?
Well, I gave her some gas drops, but I tried to kind of like when she was smaller, kind of swallow her and everything. But I breastfeed, so it was something that I ate. That
Okay. So if you have a baby that's really irritable, sometimes it can be sensory stimulation like bright lights, bright noise, being uncomfortable for some reason. So swaddling is good, not shining lights right in their eye, kind of holding them is a good thing. There's a phrase that we talk about. They talk about a lethargic baby, which always kind of scares me when you say a baby is lethargic, but it's also that when you see it in your textbook, they're referring to a baby that's overstimulated. So this is a baby that kind of shuts down, like they're so stimulated that they're not crying, they're not paying attention to their environment. So these are the same sorts of soothing things that you would do. You would swaddle them, you'd hold them close, you'd avoid bright lights, bright noises, etc. So, and then there's babies that are irritable, and then there's babies that are colicky. And colicky is just like, irritability beyond any sort of recognition. And it can be extremely, extremely frustrating for parents because they don't really know what's going wrong. They don't know why the baby's so fussy. So it does require a lot of care from the nurse to help the parents through it. This position that the mom has the baby in is the best position for a colicky baby, kind of on their stomach. It's probably like gas pains or something going on with their digestion that just really makes them really uncomfortable. And then they just cry and cry and cry. So if you ever have a parent that talks about a baby that's crying a lot, you always need to take them seriously. Sometimes they could be sick. There could be something really serious going on that's making them be so irritable, or it could be just this phase of colickiness, or that's probably related to not really digesting their food or something like that gives them these really sharp gas pains. So this is what I talked about. This is the lethargic infant, which, like I said, whenever I hear the word lethargic, I kind of makes my heart stop a little bit. So when they're talking about lethargic, though, they're talking about not really interacting with their environment. So these are the things that you do. Avoid bright lights, move them slowly, talk in a calm voice. You might want to sit them up at intervals and then make sure that you're slowly dressing and undressing them. All this is trying to get at is that babies are very sensitive to their environment. And if they're overstimulated, that can cause them to kind of shut down and not want to interact. But they still do need, some stimulation. So you don't want to just leave them flat all the time. So you're going to kind of sit them upright at intervals. And then, one of the things that's also really, really frustrating for parents is just the sleep pattern of an infant. So, prepare them that they don't sleep very much, or they sleep frequently, but they don't sleep for very long periods of time. So a newborn sleeps for 4-hour intervals. So, whether your breastfeeding or bottle feeding, you should expect that you're going to be getting up in the middle of the night to take care of your baby, because that's how often they wake up. That's normal for them. So if you're ever doing education with a new parent, you need to make sure that they understand that. And then we put babies on their backs to sleep. Does anyone know why we choose the back to sleep? What are we trying to prevent?
SIDS.
SIDS, very good. So another thing that you really need to make sure in terms of your anticipatory guidance in your education for parents is that they're staying up to date on their immunizations. Does anyone know any parents out there that don't want to get their kids vaccinated? No? Is that not common in your community where you guys are going to be working?
I know a couple of people that I'm friends with that don't really vaccinate their children.
Okay. And did they tell you why?
They have like their reasons, some religious, some just don't believe in the vaccines, and then some are just uneducated and don't really know.
Okay, very good. I just always mention it because I think, this is something that I struggled with. I'll be honest with you, my nieces and nephews are not vaccinated, and it frustrates me to no end. So my sister thinks it causes autism. So this is something that you are definitely going to encounter if you're working in pediatrics. You're going to find people that are convinced that immunizations cause autism or causes problems of some sort or another. So I just want you to make sure that you have like your response to parents. Try to educate them and also try to be non-judgmental. I would, even if they're like adamant, I'm not going to vaccinate my kid, you should mention it at every health visit and try to educate them every time, because sooner or later you might try to get through to them. 100% immunizations have been tested. They're safe. They help prevent things like meningitis and ear infections and pneumonia. So, just to kind of be aware that you're going to be running into this throughout your nursing career. Something else that you want to make sure that you're talking about with your parents is the importance of diaper changes. They can get really bad diaper rash, etc. I think urinary tract infections. And then you're always going to be doing their height, weight, and their head circumference, making sure they're getting adequate fluid and nutrition, growing appropriately. So, in addition to the height and the weight, head circumference, you're going to be doing screenings for hearing and vision, following up on their immunizations, etc. There's a slide here that I want to make sure that we get to before we do our Kahoot. So what can you guys tell me about feeding babies? I know someone said, breast milk is best, but bottle feeding is fine, and that's true. At what age do you start introducing solid foods? Does anyone know?
Is it 6 months?
It's around 6 months. And what's the first solid food that you introduce?
Rice cereal.
Rice cereal. And you introduce rice cereal because it has a very, very low allergy profile. So almost no one is allergic to rice cereal. And then how often do you introduce a new food?
Every like 4 to 7 days or something. I know
Very good. Yep, every 4 to 7 days. And why do you wait in between introductions of new foods?
Allergic reactions. Well, that's what my
Right. So if you give them bananas and then the next day you give them sweet potatoes and it looks like they have a reaction, you're not going to know if it was the bananas or the sweet potatoes. So always do one food at a time to make sure that, if they have a reaction, you can figure out what food it was. And at what age can you start introducing cow's milk?
One for a year.
At 12 months. And what are some reasons that you don't want to give cow's milk to a baby under a year?
Is
Like
it
if a
for
mom-
allergies?
Yeah. It's for allergies. It doesn't have the same amount of iron and they don't digest it very well. So they can end up with like some gastric irritation and it can cause them pain and some microscopic bleeding in their GI tract. So you never want them giving cow's milk under a year. Very, very good. And then in terms of, you guys got all the solid food stuff. In terms of bottle feeding, what are some nursing guidance tips that you for bottle feeding? Like, is it okay to bottle prop? What are some signs of overfeeding? What are some signs of underfeeding?
You should
Not
never
supposed to
prop the
wear-
bottle.
You should never prop the bottle. What happens? What could happen if you prop the bottle?
They could choke,
They
you
can
know,
choke, they can
They
aspirate.
can
Yeah.
get the
aspirate.
air.
Yeah, very good. And if you overfeed a baby, what are some signs of that the baby's getting fed too much?
Spitting up.
Spitting up, and also maybe like excessive weight gain, and then underfeeding.
Very cranky all the time.
Cranky all
crying.
the time.
Or
Yep, and also then not really gaining weight that well. And this is just kind of a nursing tip. We talked about, introducing solid foods around 6 months. It should be rice noodle, the first one. So once you get to the point where your child baby is really starting to eat, it's a good idea to do a new food that you're introduced before you give them their milk or their formula, because then they're more likely to go ahead and try it. If they're full on milk, they might not want to try whatever you're offering them. And as they're eating more and more, then you can start to back down on the amount of formula that they're taking. So these are some basic guidelines for fat intake during infancy. So one of the things, there's so much out there about like being healthy and not being obese, but you really don't want to do any sort of fat reduction when kids are really young, because they actually need those digestible fats for their brain development. So you want to pay attention if a parent's ever saying that they're using like a low fat diet in a child under the age of 2. They really need those healthy fats for their brain. So they do, they should have a well-balanced diet, and you really shouldn't be doing anything that's low fat until they're at least 2 years old. And we talked about this: encourage breastfeeding, discourage overfeeding, and try to recognize when a baby's full, they're going to stop eating, and then you don't want to do too much early introduction of solid foods, because it has a higher risk of allergies, and they also don't have the tongue control to really swallow and eat that well. As a parent, you should recognize, if you're breastfeeding when they're ready to wean, and I'm sorry, my dogs are here, so I have to let my dog walker know to let them upstairs. All right, I apologize for that. Thank you. So a lot of times parents might have questions about organic and natural foods, and it's just kind of, if they can afford it, that's great, but there isn't really any there's not really any evidence that this provides better nutrition. Okay. So this is the thing that I wanted to make sure we talked about before you guys do your Kahoot. There are some key things that you need to remember about infants. So I would definitely kind of highlight this slide number 85. These has some key points that I know are going to be on your quiz and your exam. So whatever their weight is when they're born, it should be double by their 6-month age, and then triple by 1 year. So like if they're 6 pounds, 4 ounces, they should be 12 pounds, 8 ounces at 6 months. So these are some basic guidelines when you're looking at a baby. This is how their growth should change over time. So babies are born with a big head. So when they're born, their head is actually bigger than their head circumference. So by a year, that's equaled out. They have the same, they're no longer so top heavy. We talked about, moms giving antibodies through breast milk. When babies are born, they're born with some maternal iron stores. So they have iron from their mom, but that's gone by the time they're 6 months. So if their formula is iron fortified, standard off-the-shelf formula is iron fortified, but a lot of times pediatricians will start introducing iron supplements if they're breastfed only, because their iron supplements are gone from their mom and you don't necessarily have that much iron in your breast milk. If you have a baby, they don't really have the ability to have depth perception until they're 9 months old. And these are some prime things that you should, remember in terms of infancy. When they're around 4 months or older, they should be able to roll over. By a year, they should be able to take independent steps. And then primitive reflexes are replaced by voluntary movements. So, you put your finger in the hand and they grasp it. That grasp reflex when they're an infant, that gets replaced by voluntarily picking things up with their fingers. And then usually babies start getting their teeth when they're around 6 months old. And this is when they might start biting. I think those are the main things. So I apologize that we didn't go all the way through the toddler years, but it is out there for a resource for you. I'm going to go ahead and pull up a Kahoot that will help you study for your quiz that we're going to have next week. Does everyone know how to use the Kahoots? Have you guys done Kahoots in other classes?
Yes.
Yes. Okay.
Mhm.
So let me pull it up for you. So when I put the announcements in the in Canvas, I'll put later today, I will post the lecture if you want to watch the lecture, and I'll also post the Kahoot that you can practice in class. So I try to make the Kahoots applicable to whatever your quiz is going to be. So quiz next week, I want to make sure everyone remembers that. So you need to come to class to take a quiz. And we'll have another Kahoot before class. So it'll be this Kahoot and the Kahoot that you take in class before your quiz next week that will make sure that you're prepared for your quiz. Okay, I'm going to go ahead and get started here. So the nurse explains that permanent teeth begin erupting at what age? 4 years, 6 years, 8 years, or 10 years? So a lot of you got it right. So good job. So for this one, for teeth, that's two things that start with a 6. So baby teeth around 6 months, and then permanent teeth around 6 years. So to have like a general frame of reference for when they start to get their teeth. What does self-feeding help to develop in the toddler? Good nutrition, adequate height and weight, a sense of independence, or healthy teeth? Very good. So a sense of independence. This is your autonomy versus shame and doubt. So the toddler years, potty training, self-feeding, learning to dress, if they are getting positive reinforcement and doing things that they're able to do, they develop that sense of independence or autonomy. So why is the 4-year-old likely to obey rules? The child respects authority figures, the child does not want to get punished, the child wants to please adults, or the child believes that following the rules is right. All right, so a lot of you got this. So this is getting to Kohlberg's theory, which we didn't touch on today. We'll touch on more next week, but I would certainly have in your mind, you know, one of the main things with Kohlberg is, you know, early in there, Kohlberg is the moral theorist. So why we obey rules or why we decide something is right or wrong. So when they're young, they're not really thinking analytically. They just don't want to get punished. So this is like when you're a little kid, you do something because you don't want to get punished. You do the right thing, what you're told to do, because you're afraid of the punishment. What is the earliest age at which an infant is able to sit steadily alone? 15 months, 8 months, 5 months, or 4 months? All right, so it is 8 months. So 4 months, they should roll over. And around 5, 6 months, you can kind of get them sitting up with a little bit of assistance, but you would really expect like a baby to just sit there without sitting in a car seat or having anyone support them by the time they're about 8 months. What is an abnormal finding in the evaluation of a 6-month-old? Head lag is present, weight gain of 4 to 7 ounces per week, length increases by 1 inch in 2 months, or they can sit alone for a few seconds. Very good. So the head lag is present. So who can tell me what head lag is?
Like
Does that mean?
when they can't hold their head by themselves, like up straight.
Yes. Right. So what do we do to help babies develop their neck? What sorts of interventions do we want parents to be doing with their babies?
Putting them on their stomachs.
Yeah, so tummy time, 20 minutes a day. Babies don't like it. But if you put them on their stomach, they'll put their hands down and they'll start to kind of lift their head up like that. And that helps them develop those neck muscles. So when we talk about head lag, you're putting a baby down on the exam table and you're kind of taking their arms and you're pulling them up. And if their head just stays back and they don't pull it midline, then they have head lag. So this is an indication that they're not getting their tummy time that they need, that are not developing their muscles in their neck the way they should. These other things are normal. So 8 months, they should be sitting totally by their own, but around 6 months, they kind of can sit there in that wobbly way for a few seconds. So how many hours should a toddler be able to stay dry for the nurse to suggest that they're ready to start bladder training or toilet training? 3 hours, 1 hour, 4 hours, or 2 hours? So I was surprised that it was so little, that it was just the 2 hours, but for sure, the main thing is, so at least 2 hours, you want to make sure that they are able to sense when they're going to pee, and that they're staying dry for at least a couple hours, so that when you ask them to start potty training, they have the ability to actually do what you're asking them to do. How many minutes should a 5-year-old be in timeout? 15 minutes, 5 minutes, 10 minutes, or 7 minutes? All right, very good. So there's 1 minute per age and year. So a 5-year-old should be in timeout for 5 minutes. So what type of family consists of 2 parents with children from previous relationships? A blended family, a nuclear family, an alternate family, or an extended family? All right, so that is a blended family, but I want to make sure that you guys know all of these terms. So what is a nuclear family?
Is that where
guys heard-
the parents and the children are from the same, like there's no
Right.
uh,
No
no
one's been
difference in-
divorced, no one's been separated. And it's also, and I know this is not very appropriate for our current, view of society and what a normal family is, but it's going to be a mom and a dad and the kids. So it's going to be a mom, a dad, and the kids. No one's been divorced, no one's been separated, etc. And then how about an alternate family or an alternative family? So this could be like a mom that lives with a friend, and the friend is really involved as a caregiver, but not part of the family. And even though, like I said, it's not necessarily culturally sensitive, we would talk about like homosexual couples also being an alternative family. Nuclear is really mom and dad. So this would be like 2 men or 2 women raising children together, either in a relationship or not. And then what do you think? What's an extended family?
like grandparents being involved, like
Yeah,
being raised by children being raised by other than parents.
Yeah, and it's also thinking about like multi-generations, usually in the same household. Yeah. Very good. So an infant who weighs 6 pounds, 12 ounces at birth should weigh what at 6 months? 15 pounds, 12 pounds, 13 pounds, 8 ounces, or 17 pounds? All right, so pretty mixed. So I think most of you guys know that it doubles, but how many ounces are in a pound?
16.
16. So you have to do a little bit of math there to get the right answer. So I kind of put that in there as a little bit of a tricky one. I think on the test it's probably easier, but the main thing that you need to remember is that it's a 6 months should double, and at what age should their weight triple?
1 year.
1 year.
1 year. Very good. Okay, last question. So what is an example of proximal distal development? Dexterity with the arms before the hands, head control before trunk control, vocalizing before forming words, or walking before running? Okay, good. So it is dexterity with arms before hands. So this is midline before periphery. So like trunk, arms, legs before hands, fingers, toes, and feet. So just thinking of the middle of the body, really developing before the outer parts of the body. And then what about head control before trunk control? What type of development is that? Cephalocautal. Yeah, very
Cephalocautal.
good. Very, very good. All right, Ollie. Dallas. Who's DMB?
That's me. It's Christy.
Oh, very good. Okay, does anyone have any questions about this week's material? Any questions about what you guys need to do for your discussion questions?
No.
No? Okay. So this is what's I'm gonna do. I give a little bit of time to kind of Zoom to upload all of its information, but later today I'll post a video that has the lecture, and then I'll post a link to the Kahoot if you want to practice it. If you haven't done so already, please do your introduction discussion question and discussion question number 1. And then remember that next week we have our quiz. So please make sure you come to class for your quiz. And if you guys have any questions about anything, either send me a text or send me an email and I'll get back to you. And if not, then I'll see you guys next week.
Thank you.
Bye-bye. You're welcome.
Thank you. Have a great day.
You too.
Thank you.